Hi friends, this is Professor Dr. Raj here, the chairman of Dr.Raj Advanced Dental and Implant Center. Today, in our episode, I am going to highlight you about the importance of an artificial full denture. Now, many of us would think what to do after extraction of the tooth or removal of the tooth. Many a times when I see the patients are least bothered to construct a false teeth in place of a missing teeth, which is highly wrong. Even if one tooth is lost, it has to be immediately replaced by an artificial tooth for many various reasons that I will list it in the next episode. Now, in our dental hospital, we are rendering a very economical full denture because the people who have lost all their teeth have an apprehension that what to do, how to eat, how to smile, and they have complaints of indigestion as well. So this problem is a vicious cycle which will not stop short even with a small denture or an ill-fitting denture or anything like that. So therefore, the patient has to be given a thorough examination and a wonderful replacement of his missing tooth. Therefore, we at our center have regarded this particular phenomena of lost teeth to be replaced by means of a latest technique and a complete denture within a span of short period of 2 days, for which we have an in-house technician who helps us in this regard and enables to perform this full denture within a span a matter of 2 days. The cost factor is very reasonable and which is more affordable and pocket friendly to everyone. And a full denture, how it appears. Now I am going to show you a full denture. This is how a full denture appears. This is the upper denture and this is the lower denture. So therefore, a patient need not have the fear that it will be very costly. So what can we do and all those things. Normally a full denture will take at least 5 to 1 week to prepare. But we at our center will do it for just a matter of 2 days with all the quality in place and happiness of the patient's smile. Thank you.